Okay. Good afternoon, everyone. Bolaji Adedeji is my name. Can you hear me? Can you
Yes,
hear
yes,
me?
perfect, perfect. Go
All
ahead.
right.
Yes,
Bolaji Adedeji
yes.
is my name. Okay. I'm a consultant gynecologist in St. Emmanuel Hospital, and I will want to talk to us about antenatal and postnatal care as part of our 58th anniversary celebration. So to educate us about certain things that are very important about pregnant women. So without wasting time, I will like to start immediately. So the question is, what is antenatal care? I believe we can all hear me.
Yes, you can. Yes, I can from here.
All right. So antenatal care refers to a specialized form of care given to a pregnant woman right from conception to delivery. Why are we talking about this? Why is it important? We know that pregnancy could come with complications, either initially diagnosed or undiagnosed. So it is important because it gives opportunity for pregnant women to know their condition right from the time, medical condition, right from the time they conceive. What are the components? The components include assessment, health assessments, screenings, health and counseling. I'm going to talk into depth along the while along this presentation. So the aim is to ensure good health for both the mother and the fetus during the pregnancy and even to prevent complication. So, having said that, there is we part of what we do during antenatal clinic include regular visits. This allows us to detect if there's any issues and allow for timely intervention. As we said, is a kind of preventive care, so to say, because the patient might not even have any symptoms or any complaint. That's one of the things we do tell our patients when they come to the clinic. Some of them will say, if you tell them you miss your clinic, they will say, no, it's because I'm feeling okay. I don't have any complaint. No, there might not be complaint, but there are things that could be picked when they present during the clinic that could impact negatively on their health. That when discovered and we intervene, it's going to kind of reduce the complication that could arise during the course of the pregnancy. So these are the importance of antenatal care. Like like I mentioned earlier, it prevents. It prevent complications. What are the likely complications that will come with pregnancy? We mean something like gestational diabetes mellitus. This is a kind of elevated blood sugar during the course of pregnancy. It is that is the first time that is being detected during the course of pregnancy, and it could impact negatively on the health of both the mother and the baby. Also, to prevent some of the things that could be prevented include preeclampsia and infections. Preeclampsia is just a condition whereby there is elevated blood pressure with protein in the urine, and this could result to a lot of complications, which I will talk about along the course of the presentation. Then it also allows us to give them talk about health education. We educate the mothers about the nutrition, the exercise, lifestyle habits. The nutrition is in the sense that we let them know the combination of food items that could impact positively on their health and the health of their babies. This include we encourage them to eat fruits, vegetables, and also protein diets, vitamins. Of course, we often supplement some of the vitamins, especially the iron, the vitamin C, folic acid, just to ensure positive pregnancy outcome. So exercise, moderate exercise, we encourage them to do moderate exercise because of their pregnancy. Why? Because it keeps the muscles, their bones and muscles fit, and it prepares them for the delivery that will soon happen at the end of the pregnancy. Also, lifestyle habits like some of them that might be smoking, though not common in this part of the world, but it's a possibility. We encourage them to stop because it could cause adverse effect on their pregnancy. Intake, I mean, drinking of alcohol. Yeah, there's something we call alcohol syndrome in the baby. So we encourage them to reduce or even stop. And also, I know some people love to take coffee. So coffee is not also encouraged, or yeah, we discourage it. There are a lot of food that are not supposed to be taken in the course of pregnancy, but I won't be able to exhaust all of them because of the time. But in the if there is any question about it, we can talk about it during the question and answer. Then it also allows us to monitor the baby, the growth of the baby, the the growth. If there's any structural anomaly, ultrasound can help us detect this. Also through the blood test and other diagnostic tools that we can use. Then it allows us to detect some complications early and able to intervene early. Complications like elevated blood pressure, anemia, infections. So these are some of the things that can be picked on time. And the like I mentioned earlier, is a form of preventive medicine. So when we discover it on time, it gives an ample time. When a woman register or I mean starts antenatal clinic on time, we have enough time to detect this and work through the investigation and give the appropriate treatment. But if such woman is registering or booking late, we might not have enough time to do all of this, and it could impact negatively on the outcome of the pregnancy. Emotional support. There is no doubt that pregnancy could come with emotional and mental disturbance. When they present for the antenatal care, we're able to give them counseling, support them, address their concerns, even to an extent that if there is need to involve social workers to get to the root of their problems, we offer this as well. So you can imagine if we are able to achieve all of this, yes, we are expecting I mean, elder mother and baby, an happy family. So, um, okay, thank you. So now these are the components of antenatal care. Now, the component includes when they come, that is the initial visit. We call it booking visit as well. That is the first time we are seeing them. That is the interactive stage. We are getting to know them. So this involve taking their biodata. We ask for their age. Why? Why do we ask for their age? We know people at the extreme of reproductive ladder are prone to complications like preeclampsia, like labor obstruction, due to inadequate pelvis, especially for those one in the teenagers, anemia in pregnancy. So there are a lot of conditions that will, I mean, complicate such pregnancies. And people at the upper end of the reproductive ladder are prone to have complications like preeclampsia, eclampsia, gestational diabetes, and other medical conditions in pregnancy. So that is the reason for the age. Then the number of pregnancies they have had, this will allow us to determine how, I mean, to assess the risk they might be going through, because some of them that have so many children in the past are prone to uterine atony, uterine rupture based on the history of the previous pregnancies. So then also we ask for if they have any medical underlying medical condition that they are aware of before they presented for the booking. This will help us anticipate, investigate, and manage them appropriately. So these are the some of the. Then we have for their blood group. We know if, especially for the babies, I mean the patient with resource isomerization, that is resource negative people. We ask for their because of this, we need to know if there is incompatibility between the couple, and so that to anticipate hemolytic care disease of the newborn, and to preempt and put every strategy in place to ensure that the pregnancy outcome is good. Then some of we discuss we ask them, we try to investigate them. Sorry, I we try to do a medical examination on them from head to toe. We check for if there is presence of anemia, if there is presence of jaundice, if there is a pre-existing condition. Then, if they have done previous operation in the past, this can be obvious from the abdominal examination, because we're going to detect the previous scar. We can as well ask about the number of surgeries that they have done in the past. This will also could impact, it can put them at risk while trying to deliver them, because people that have had multiple surgery in the past, we know if they come in, I mean, to book, we need to talk about the mode of delivery in terms of the another repeat cesarean section. So then we investigate them. What are the investigation that we do? We do urine test, we do blood test. Urine test, if in the case of urine test, if there is a glucose, we know it could be suggestive of gestational diabetes or pre-pregnancy. I mean, the type 2 diabetic mellitus in pregnancy. So this might allow us to we make the diagnosis and prefer uh, necessary care to this group of patients. If there is a protein in the urine, and especially in the presence of elevated blood pressure, so might be suggestive of preeclampsia. So we want to also treat them accordingly to prevent the complication that will arise from such. If there is presence of leukocytes, it could be mean urinary tract infection. Urinary tract infection is one of the things that could predispose pregnant women to preterm labor. So we assess them further and we give them the appropriate treatment to prevent complications. So then we counsel them on diet, like I mentioned earlier, diet like protein, fruits, vegetable. This will go a long way to help them in the course of the pregnancy. Okay. Then exercise, moderate exercise. I think many people try to ask this question about exercise. That what is it? Can I be doing exercise? But it's not a stressful or too strenuous exercise, because too strenuous exercise could provoke, I mean, a preterm contraction or preterm labor. So it is a moderate exercise like aerobics, taking a walk, and doing all this, living a normal day to day, doing normal day to day activities. This will help a lot in the course of the pregnancy and prepare them for delivery ahead. Then prenatal vitamins. This is essential because there's most at times our pregnant women, any pregnant woman is prone to have what we call dilutional anemia, pre-existing anemia or dilutional anemia. Dilutional anemia just means that because that woman is retaining water in her body system. So even if that woman is have a normal blood level, normal red blood cell level, because of the retention, water retention, it makes it go down, and this could impact negatively on the baby, because there is need for in transportation of oxygen and nutrients to the baby, which is the function of red blood cells. If this red blood cells is deficient, it could cause adverse effect on the baby. So there's need to supplement this. I'm going to talk more on this as we go. So routine checkups. Routine regular checkup, when they come, we check their weight, we check their blood pressure, the pulse, and we try to see. Concerning the blood pressure, we should not be more than, I mean, should not be in the hypertensive range. So if we discover any elevated blood pressure, then we try to find out what the cause is and treat appropriately. The weight gain, well, it is normal for a woman to gain weight during the course of pregnancy. However, for a healthy weight before pregnancy, it is expected that 10 to 12.5 kg is fine during the course of pregnancy. However, some women will say, doctor, I'm overweight, I'm obese. I want to lose weight while I'm pregnant. No, it is not advisable. Fine, you can. The weight gain for people that are on the big side is not the same for the people that have a normal body mass index. So we advise that they should I mean, their own weight gain should be in moderation. So such that they should do based on the diet. We cancel them on diets so that they will not get weight excessively, and we encourage them to engage in moderate exercise. This is also important. Then we screen the along with diagnostics tool like ultrasound scan. This allows us to monitor the growth of the baby and to detect if there is we're suspecting gestational growth restriction. When there's a fetal growth restriction, it allows us to detect this on time. Then for the blood screening, we have the various blood screening that can be done. Then to which we allow, like for instance, in the case of gestational diabetes mellitus, we can screen for this. There's something called oral glucose tolerance test, which will allow us to detect this and other infections, which I'm going to talk about in the next slide. Then vaccination, like tetanus immunization, is also important because we are in an endemic area. We cannot uh, be too sure of sterility of the environment. This will prevent neonatal tetanus, and also there is a we give a prophylaxis for malaria. That is intermittent preventive therapy for malaria. We give 2 doses. Now the WHO have approved that it could be given even up to delivery, which we have been doing. Then we try to educate them wisely concerning the childbirth, what to expect, and the hygiene during the pregnancy, then the breastfeeding and how to manage breastfeeding, the positioning of breastfeeding their children, how regularly they should breastfeed, practicing exclusive breastfeeding. This is very important to achieve a good pregnancy outcome. So some of the tests that we request for the blood test include pack cell volume. This is to know the level of the blood level of the pregnant woman. It is very, very important because, like I mentioned earlier, anemia in pregnancy could be dangerous to both the mother and the baby. And because of the changes that happen in pregnancy, so like the growth of the womb up to the level of the diaphragm. So it causes splinting of the diaphragm because of the edema, the changes around the airway of the pregnant woman. So all these conditions could easily, and especially when the woman is lying on her back, it could reduce the blood and cardiac output. So all this will aggravate the effect of anemia in that woman. So it is necessary to know the blood level, and if it is low, it should be treated appropriately. Then the blood type, like I mentioned, the blood group, if it is rhesus negative, we treat appropriately. Infections like HIV, hepatitis B, hepatitis C, syphilis will be screened for. And if we detect any abnormality, then we cancel the woman and we take steps to treat so that we can reduce the risk of complication on that pregnancy. So urine tests, we allow us to detect the presence of protein, glucose. Like I've talked about this earlier, presence of protein could be with elevated blood pressure could mean presence of a preeclampsia or gestational diabetic mellitus. So these are some of the diseases, and also it could mean presence of protein in the urine could also mean urinary tract infection. All these things will allow us to manage appropriately when detected. Ultrasound scan to monitor for the fetal abnormalities, both structural abnormality, some pregnancies due to what the pregnant women got exposed to early in pregnancy are prone to have structural anomalies. So this anomaly scan is usually done around 18 to 22 weeks, and when there is history suggestive or that suspicious of exposure to dangerous elements, so we advise pregnant women to do this so that to reduce the possible complication that could come with it, or to detect if the baby has been affected, and such baby will be managed appropriately. Also, glucose screening, I think I mentioned this. This is a oral glucose tolerance test, which we use, especially for people with previous history of gestational diabetic mellitus. So we advise them to do this test so that if, because of the risk of recurrence in the index pregnancy, it will allow us to detect if there is a recurrence, and we'll be able to manage it appropriately. So the group B stress test is usually not done in our environment, but is a good test because it could result to preterm labor if present. So next slide. So for the nutrition, we encourage our pregnant women to take a balanced diet. We encourage diet rich in fruit, vegetables, lean protein, whole grains, and healthy fat. Balanced diet is going to impact positively on their pregnancies, both for them and for their babies. So then these are some of the nutrients that we give them as a supplement. Folic acid. This is very, very important, especially in the first 3 months of pregnancy, to prevent what is called neural tube defect. We notice that these days most women are not pregnant, are not getting pregnant early. Most of the patients that we are seeing these days, based because of the empowerment, women empowerment, gender, women empowerment. So people are being empowered, and they are not getting, because of career, they are not getting married on time. So this predispose them to have their genetic or structural anomalies. So when they get pregnant, their babies to get genetic or structural anomalies. So folic acid helps to prevent one of the structural anomalies is a neural tube defect, which can be prevented by giving folic acid. Iron supplementation is also important in case of anemia if detected. And even because of dilutional anemia that I mentioned earlier, it is important to also give iron supplementation, even if their blood level is still normal. Calcium is also given. This helps in the bone development of the fetal bone, and some studies has also been done that reveal that this could prevent conditions like preeclampsia. So also vitamin D promotes the absorption of calcium from the gut. So also the vitamin C, which is not included here, it helps in the absorption of the iron given to them. We encourage them to hydrate very appropriately. Dehydration could predispose them to preterm labor, so we encourage them to hydrate appropriately. There, there are some food items that we encourage them to avoid, like raw fish. Of course, there is no reason to go for raw fish, but for some reasons, maybe seafood and all that. So we encourage them not to ensure they boil anything that goes into their body. Like raw fish, could come down with infection with listeria, which could cause preterm contraction or preterm premature labor. Unpasteurized milk, same thing with unpasteurized dairy, and excessive caffeine is also discouraged because this could cause a fetal growth restriction in them. So we discourage this as well. So for the first part, in conclusion, for the antenatal care, it's to summarize everything is a care given to a woman during pregnancy, right from conception to delivery, and it ensures the well-being of both the mother and the baby. The regular checkup, screening, and health education can help detect and prevent complications during pregnancy, which I have talked about earlier. Encouraging balanced diet, regular exercise, emotional support are all key components of ensuring safe and healthy pregnancy. Pregnant women should seek professional antenatal care as soon as they suspect they are pregnant, ensuring timely and they should to ensure timely interventions and outcomes for both mother and baby. This is very important because I've heard people ask me different times, when can I start antenatal? Can I start antenatal at this time? Now, it is advisable to start antenatal clinic at the second missed period. Meaning, once a woman misses a menstrual period, she is advised to register or book after 4 weeks after, meaning that you miss the first one and the second one, you miss the first one and the second one. For the second one, and you have tested positive for pregnancy, then you should start your antenatal care. For some people that have complication in their previous pregnancies, they are supposed to present as soon as they test positive for pregnancy. So that as to ensure that the intervention can be instituted early in their pregnancy. Next slide. Now, okay, now that the baby has arrived, so what is the next step? Okay, so we're now moving to postnatal care, which is also important. So it's a kind of care given to a woman post-delivery to hasten physical and emotional recovery, which provides smooth transition to parenthood. And that is just simply what it means. Because delivery comes with a lot of, I don't want to use the word complication because complication means that when somebody hears complications, there is something that is very, very big. No. But however, a woman that just delivered per vaginal could have perineal pain. So, what are the things to be done to make this period, like less burdensome for them? So, perineal pain is one of the things that could happen after the delivery, especially if the woman has a vaginal birth. So some of the things that could be done includes encourage them to put ice pack. How do they do this? Ice pack could be wrapped up in a like an handkerchief or a towel or flannel, so which will be placed on the painful part of the on the perineum. This could soothe the pain and makes them function normally. Then seat bath is also could also be done, especially for a woman that had a cut on her perineum. This is going to help to prevent the wound infection and hasten wound healing. Peri bottle. You can see the bottle showing in the picture is called peri bottle. It is used by women after delivery. It's just instead of using their hands to wash their perineum, this is used to, sprinkle water and then wash off whatever debris or any stain on their perineum. Then they are encouraged to wipe from front to back. This is very, very important to prevent infection. Wiping from front to back means that the anything is not coming from the back to front, which can infect. The back side, the back side is occupied by the anus, where the feces come out from. So this could cause urinary tract infection or even infection of the genital tract. So that's the reason for the wiping from front to back. Then to change the pad every time they urinate, this is just to ensure proper hygiene. Then there's something we call witch hazel and tox pad. This these pads the helps in causing softness. They prevent irritation. After delivery, they will still be coming. The local will be coming, and this could cause irritation. So these are some of the medications that we give them: ibuprofen, acetaminophen, cocodamol, and stool softener will also be given because some of this medication could cause constipation. So next slide. So we encourage them to take proper nutrition, balanced diet, protein-rich diet, fruit and vegetable hydration. This is not too different from what we ask them to do during the course of pregnancy. So it's just a continuity from what they have been practicing while they were pregnant. So there are different fruits that can be taken. There are different vegetables, and preparation of their vegetable is also important. They should not overcook it so that the minerals that are present will not be washed away. So hydration, 8 to 10 glasses uh, of water. So for postpartum bleeding, discharge can last up to 6 weeks. So there's need for them to kind of pelvic rest for 6 weeks, meaning I don't think any sexual activity could resume before then. Then they should come to the hospital if they notice they are bleeding excessively. If after delivery, if we discover their blood level is low, we try to give them hematinics. And for some of them that their blood level is extremely low, we can consider blood transfusion in them. So these are some of the infections that could arise. Infection of the lining of the womb, we call it endometritis, engorgement or breast engorgement, and puerperal pyrexia. All these conditions can be taken care of with counseling, self-education, and administration of antibiotics. This will help prevent the possible burden of a puerperal infection that could happen, especially when in a woman that was delivered in a poor settings or in poor settings. So next slide, please. So, pregnancy could come, post delivery could come with emotional and mental disturbance. Some of them but the three major ones are called puerperal blues, postpartum depression, puerperal psychosis. So for puerperal blues, it usually happens around 2 to 3 days after delivery. It could come present with anxiety, depression, unnecessary cry, getting detached from the baby. So, however, it resolves within 2 weeks after delivery. So what the patient needs here is support from the relatives, and they should understand that something like this exists. I can remember a particular patient shared experience with me, and everybody started looking at her like being weird. No, it wasn't her fault. It's just the physiological condition or mental condition is happening at that time in her. Postpartum depression is usually happens up to 4 to 6 weeks after delivery, and it could last long. And this could come with losing interest in previously pleasurable activities, detachment from family and friends, cry, mood swing, low mood, and even sometimes it could cause a suicidal patient might even consider injuring a baby. Oh, sorry, that happens in puerperal psychosis. In puerperal psychosis, it's usually around 2 weeks after delivery, and it could cause with hallucination, hearing words when nobody's talking, seeing things that are not present, and It could uh, patient might have suicidal ideation or might even try to injure the baby. These are serious conditions, and sometimes there is need to involve the psychologist or even psychiatrist for proper management in them. So there might be issues with bonding with the baby because when a woman is not in the right state of mind, bonding with the baby will be very difficult, and this might impact negatively on the on the patient and the family. So these are miscellaneous things that can be done. Now that you are at home, what are the things that are expected? You need to breastfeed. No, you need to know how to position to sit properly when you want to breastfeed. The method of breastfeeding. This must have been taught by the midwives even before you were discharged from the hospital. Then wearing supportive bra will help to prevent breast engorgement. Then cold compress in case there is a blood breast engorgement. This is going to reduce the pressure and the pain that will come from the breast engorgement. Then in the course, while in the post delivery period, patients should aim at losing weight. It varies. It depends on your pre-pregnancy weight. 4 to 6 kg could be targeted based on your pre-pregnancy, but there are variations. So I won't be too specific on this. So Kegel exercise helps, especially for those that have a vaginal birth. It helps because there is tissue destruction during the childbirth. So and there could be those muscles that helps in voluntary control of urine and feces could be affected. Hence, it could result to incontinence, whereby patient will be leaking urine or physics after delivery. So Kegel exercise helps in returning the functions of these muscles and make them to work properly. Then gentle exercise could be started 6 weeks after, from 6 weeks after delivery. This will help you to return back to your pre-pregnancy state. Then baby care, you using when you are trying to cut the nail of the baby using the right clipper, small clipper with larger handle. This is to prevent the injury to the nails of the baby. Then taking a car seat for the baby is also a good thing to prevent injury while driving for mothers that are driving. So this is also a good thing to do. So of of importance is a family planning. Family planning is very, very and sexual relationship. Now, people will ask, let me start from the sexual relationship. When can I start having sex after delivery? There is no time frame. When your bleeding or low care has stopped, you are physically and mentally fine, you can resume sexual activities. So there is no time limit. However, most times we encourage to wait until 6 weeks postnatal checkup so that we can assess your health generally and be sure you are fit to go. Then for family planning, there are various methods because there is need to give child space, so that the mother can recover from the effect of the last pregnancy. Also, to limit the number, to minimize the number of family for health reasons, for economic reasons. This is very, very important. There are various methods of family planning that we have. We have the hormonal, we have non-hormonal. For the hormonals, we have different forms. The one that can be taken orally, the one that can be given as an injection every 3 months, the one that can be given as an implant underneath the non-dominant arm, which can last for 3 years. And we have the one that can be inserted into the womb. We have for the non-hormonals, we have those ones that are, we have condoms, which is a form of barrier method. We have intrauterine contraceptive device, which we call IUCD, which is also non-hormonal. So these are some of the things that we discuss with them to prevent unwanted pregnancy and its sequelae. Next slide. So thank you for your time. I hope you all have questions to her. I know you have questions to ask, so I've been waiting for that. Thank you. Hello.